Hi everyone. Okay, so now we have Mo standing, and he can feel the weight of his body lined up with his feet against the mats. He can feel the mats pushing back up against his feet. He can feel the position of his pelvis and feel his torso stacked on his pelvis and his neck nice and easy in line with his spine. His chin slightly tucked in a way that's comfortable. And now he's really focusing on his center of gravity and his feeling of weight. Now what we're going to do is make sure that your feet are wide enough apart. And when we initiate this hip hinge movement, we want to really use our hips to lead the movement, not our knees. So Mo will show you what most people do. They tend to use their knees and come forward to start the movement. It's not as stable, not as much input coming into your brain. We want to use it the more stable way, the way you did it when as children. If it ain't broke, don't fix it. And that's the way we do it. So what he's going to do now is really easy actually. Just put your hands in front of your hips and slowly push back just slightly and feel your hips come back. And he'll notice that his spine stays neutral, his neck stays neutral. It's nice and easy. The movement starts with his hips, and the knees, they're not locked in straight, they just follow along. And when he comes all the way back to come forward again, all he has to do is kind of put his hands on his backside and push forward. And that's the feeling that you want, nice and easy. Almost everyone comments that it feels a lot easier to do it this way. Now, what some people say is that they find it difficult to stay balanced and they feel like they want to fall backwards. And they'll try to compensate for that lack of balance by just bringing the whole body, either taking a step back like that or bringing their torso all the way forwards. But that might hurt your back if you don't have a strong enough core to support that. So we're going to show you now some other ways you can do it if that's a bit too challenging. So for some people who find it difficult to do that hip hinge movement, that weight shift is, they're not quite used to it, they feel like they want to fall backwards, then what you can do is you can just get some rope and hang it to something sturdy, or you could use a doorknob or anything, fasten something to something just to help you suspend yourself. And you do the same thing. So make sure, if you want to make it easier, you can bring your feet wider and wider apart. But the important thing is to start the flexion with your hips. The first movement comes with your hips, like that. And now, Mo's knees are kind of locked in here, but you can make it, and come back up now, starting with the hips. There you go. And you can see, come back down. It's kind of like those flamingos on the yard, on your neighbor's yard. They still use those. And then come back up. There you go. The hip opens up. It dries up the torso. Come back down. And the hip comes back. The knees follow. Spine stays neutral. And so you don't fall backwards. You can use your arms as you need. And then you can even pull a bit if you need the help, but really you want to focus on using your hips to drive the movement and feeling that force driving down into your feet, digging in, feeling like you can do it even without the straps, or at least preparing for the eventuality that you'll be doing this without the straps. We'll show you another way to do it also. So in this example, we're using a stability ball. I would use a wall, but we're just doing it against the post here so that you guys can see him from the side. And what you want to do again is ground yourself, being very aware of the way your weight is stacked up, one joint relative to the other, one body part relative to the other, and how it all stacks up versus the ground. Make it nice and comfortable, easy. And I would check in and see if you can get them to feel the same between when you keep your eyes open and when you keep your eyes closed. That's a common theme in this type of rehabilitation, where when we want to really focus on training the somatosensory system, we want to take away from visual input, so by closing our eyes. Now what Mo's going to do is initiate the hip hinge movement again by bringing his hips back. He's gonna follow the contour of the ball. If he feels like he can't balance himself, he has the ball there to help him. He can just lean back against the ball. He should feel some loading of his hamstrings, especially for those people who feel like they have tight hamstrings. You'll feel it kind of stretch a bit. That's good. And then he's gonna come back up, initiating the movement with his glutes, with his hip, and the knees follow. And that's what it looks like. You'll notice that the spine stays neutral. It stays solid. The neck stays solid. It doesn't really move. All the movement is taken onto the hips and on the hamstrings and down into the feet. And if you can do this eyes open and eyes closed and get them to feel the same, get them to feel like you could do it with, you could use the same strategy internally at the brain level with your eyes open, that's a great start.